Today we start a topic of puberty and its problems. That the problem of the puberty is the precocious puberty or either it is delayed puberty. Precocious puberty means the puberty can avail before his normal age, and if the delayed puberty means the normal age when the puberty begins in a person or male or a female child that is not achieved by their age. I'm Dr. WASEEM JAMALVI, Assistant Professor of Department of Pediatrics, Unit 1, the University of Health Sciences, and Dr. Ruth K. M. Foss, Hospital, Karachi. To start and begin with what is the precocious and delayed puberty, we should aware of that. What is puberty? Puberty, you all know about it. Okay, that is basically a period when there is a growing boy or girl undergoes the process of secondary sexual maturation. That secondary sexual maturation is involved the series of the biological and physical transformation. That process can also an effect on the psychosocial and the emotional development of that girl and a boy. This puberty is usually starts in the girl with the thelarchy. Thelarchy means there is the slight budding of the breast tissues, and in the male there is the slightly thinning of the scrotum with the development of pubic hair. These are the different early stages of the pubic secondary sexual characters, and we can follow these secondary sexual characters gradually with the different ages. So the onset of the puberty is varies among the individual, but usually in the girls it occurs to start with the between the age of 10 to 12 years, but in the boys that is between the 12 to maximally on the 16 years of the age. Adolescent girl reach the puberty today is slightly earlier as compared to the previously, with the certain environmental influences and the nutritional problems and the nutritional issues. There may be a slightly changes in the age varies from the 12 to 10 to 12 years, 14 years of age, and male wise it is in between the 12 to 16 years of age. This is very important thing. We should all aware of that. What is Tannery staging? Tannery staging is basically a scale. That scale is you can check the physically the development of the secondary sexual characters in the girl and the boys and the adolescent and the adult. So what is the Tannery staging of different age group? This Tannery staging first time described by a British pediatrician, Mr. James Tanner, and that's why this name was Tannery staging. And this scale we can physically measure and physically check the different secondary sexual character of the female, like the breast or genitalia and the pubic and axillary hair. But in the male, there is the checking the penis and the testicular volume with the pubic hair and the axillary hair. These are the main different things we can check in the male and the female for the secondary sexual characters. What are the different stages in a different age group? There is the certain different Tannery staging. Like we start with the genitalia of the male. There is the 5 Tannery staging, the Tannery stage 1 to 5. If you look at the slide, there is typically till the age of 9 years, there is a pre-pubertal testicular volume and the penis size. We go through one by one. That is very important. That's why I read it out from Tannery stage 1, that is till the age of 9 years, and that is a pre-pubertal, and the testicular volume is around 1.5 ml, and the penis size is less than 3 centimeter. But after the 9 year till the age of 11 year, this testicular volume increases up to the 6 ml, slightly thinning of the scrotum and redness and enlargement of the scrotum. With the penis length is not change in the penis length. But in the Tannery staging 3, after the age of 11 till the age of 12.5, that volume increases up to the 12 ml, and the scrotum is more enlarged and the penis begin to enlarge up to the 6 centimeter. After the 12.5 years of the age till the 14 years of age, there is the more enlargement of the testicular volume that is up to the 20 ml, and the scrotum is enlarged further and dark with the increased penis size till up to the 10 centimeter with the enlargement of the circumference. And Tannery stage 5 is the normal adult size of the testicular volume, that is more than 20 ml, and the adult scrotum with the penis is around 15 centimeter in length after the 14 years of the age. These are the different Tannery staging. That is the very important to know at what age what is the volume size and what is the penile size in different ages and a different Tannery staging. Simultaneously, if we look at in the female, then there is the definitely we look at the breast budding, and there is the different age group. The Tanner stage 1 is prepubertal and there is no glandular tissue. It's the prepubertal and the skin contact with the chest, that is prepubertal up to the age of 10 years. But in a 1.5 year, from 10 years to 11.5 years, there is slight breast budding and a small area of the surrounding glandular tissue, and there is the areola begin to the widen. In that after these 11.5 years till the 13 years of the age, there is breast begin to become more elevated and extend beyond the border of the areola, and which counts for the widen with the remain encounter with the surrounding breast. After the age of 13 years till the age of 15 years, there is the Tanner staging 4. And in Tanner staging 4, there is increased breast size and the elevation with the areola and the papilla formation. And this is secondary mount projecting with the contour of the surrounding breast. And after the age of 15, there is the total breast, it reaches the final adult size, areola return to the contour with the surrounding breast with a projecting central papilla. This is the breast enlargement step by step in a different age group with the Tanner staging 1 to maximum of Tanner stage 5 on different age. In a Tanner stage 5 means in a male or the female, that is the normal adult achievement of the secondary sexual character. The third thing we can check, that is the pubic hair. In the pubic hair, in the male and in female, both are the same, and that is a start after the age of 10 years with the Tanner stage 1, and around 15 years of age, that is goes to the normal hair formation of the pubic hair formation. So in its stage 1, there is no pubic hair. This is prepubertal Dominic state up to the age of 10 years. But after the age of 10 years, up to the 11.5 years of the age, the small amount of the long downy hair with a slight pigmentation at the base of the penis or scrotum in the male, or in the labia majora in the female. And after the 11.5 year till the age of 13 years, the hair become more coarse and curly with the begin to extend laterally. In a Tanner stage 4, the adult-like hair quality that extend across the pubis but sparing medial side of the thigh. But after the age of 15 years of age, that is the normal hair growth of that involve the medial surfaces of the thigh. If we look at on the picture, this is the picture on your left side, the male environment and achievement of the Tanner staging from 1 to 5, and on the right side, and a picture that is the involvement of the breast and the pubic hair gradually with the Tanner stage 1 till 5. That is the normal growth of the secondary sexual characters. This is the normal growth of the secondary sexual character. But if there is a child, a male or female baby who develop the puberty earlier than that, according to this standard staging, earlier than this, that age, that is called precocious puberty. In a precocious puberty means that the early abnormal puberty, and is called precocious puberty, and characterized by the early development of the sexual character, and that is earlier than the 8 years of age, around the 8 year of age in the girl, and around the 9 year of age in the boy is called precocious. In a precocious puberty, what happened is basically there is the hormonal changes in the body, the certain drop in hormone and different sex hormones, they can be produced rapidly and ultimately turn out to be that if there is a very fast growth early, and the child may be they're very high in other peers of that group age group, but ultimately the height is as there is the very rapid production of the different hormone, including the gonadotropin releasing hormone and the different other hormone of the anterior pituitary gland that can cause the early closure of the epiphysis, and the ultimate height is short. So this is the main thing in a child and a male and a female. The ultimate height is low. So what are the causes of precocious puberty? The one thing is, remember, even in the precocious puberty, there is the, that in the precocious puberty, the Tannery staging is seen. The patient, a child, a male or a female, can achieve the Tannery staging with the same sequence of stage 1 to stage 5, but the age is earlier than that. They start early and they close early. So the puberty is basically the sequence is same. Sequence is no change in the sequence in the Tanner staging, but they can achieve earlier than that according to their normal age. And in different causes, if there is basically the problem is that there is the early and a rapid production of the different hormones, and these hormones can be formatted in the form of the tumor or growth of the ovaries and the adrenal gland, pituitary gland, or sometime from the brain. The other causes may include the central nervous system abnormality. Sometimes there is the family history of this disease and a certain rare genetic disorder, which I will tell you later on. In many cases, and in most of the cases, in a precocious puberty, in a male and a female, there is no cause found to be some disorder. So we label it, this is the idiopathic problem. So there is a two type of usually the precocious puberty, and the number one is the gonadotropin dependent precocious puberty. Number two is gonadotropin independent. And the gonadotropin is basically GnRH, the gonadotropin releasing hormone. The gonadotropin dependent precocious puberty means this is the central precocious puberty. This hormone is generated in the hypothalamus, and then they can be involve the whole body, and ultimately the child can achieve early response of that gonadotropin releasing hormone, and they release the different hormone, the sex hormone like the testosterone, LH, and FSH, and early affect the most girl as a disorder, and the half of the boys with this disorder of the gonadotropin dependent and central precocious puberty. And the gonadotropin independent precocious puberty means there is this is not dependent on the gonadotropin releasing hormone. So it is not the central precocious puberty. It is basically a peripheral precocious puberty. There is the changes in the ovary or in the testes, and there is the increased production of the different hormone, and they can cause the precocious puberty. What are the symptoms? As I earlier tell you that the symptoms are the same. Like a normal puberty, the puberty is secondary sexual characteristics in the girl, the budding of the breast, the pubic hair, the axillary hair, and there is a menarche secondary to the ovulation. This is in the girl, but in the boy, that is with the same thing, that is the enlarged penis and the testes, and a pubic and axillary hair, facial hair, definitely the spontaneously erection of the penis, sperm production, development of the acne, and the one thing is most important, the deepening of voice in the voice. So these are the different characteristic, and the other characteristic is the typical moodiness associated with the hormonal changes with the increased aggregation. And I previously told you that there is these children are taller than the peers at that time. But the most important thing in these children who has the precocious puberty, the ultimate height is low in these children. So this is the important thing. So how can we diagnose? So that for the diagnosis, the first thing we can start with this, the most important thing is check the medical history. As I told you previously, there is sometime there is the family history. So we check the family history and ask all the different thing, and the physical examination. And in the physical examination, we look at the growth of the secondary sexual character and plot it on which Tanner stage is he is on, follow the which Tanner stage with the according to his age or not. First thing we can check in these children is the X-ray. An X-ray, usually in early age group, the X-ray wrist for the bone age, or X-ray elbow joint to determine the exact bone age of that child. Initially, the bone age is higher than the chronological age. Chronological age is basically the age which is related with the birth and with the date of birth. But the X-ray, in X-ray, the bone age is related with the maturation of the bone. Simultaneously, we can check the certain hormone like the gonadotropin hormone, like the LH and FSH, estradiol, testosterone, and thyroid hormone as well. Because the thyroid hormone also a product of their pituitary gland. So the other thing we can check with the ultrasound of the adrenal gland and the gonads, and the gonads means the ovary in the female and the testes in the male. And the simultaneously we check the gonadotropin releasing or stimulating hormone. This hormone is produced by the hypothalamus, and it stimulates the pituitary gland to produce the gonadotropin, which in turn to stimulate the production of the sex hormone in the gonad, and estrogen in the female and the testosterone in the male. And stimulating test will determine the form of the precocious puberty, either this gonadotropin dependent or gonadotropin independent. And which can we can go for the magnetic resonance imaging of the brain of the both sexes, the male and the female. Usually in the female, this is the central cause. There is a certain problem in the CNS, or more than 50% of the boys can have the central precocious puberty. So what is the treatment? Basically, the goal of treatment is to stop the precocious puberty and take the chance to the child to achieve the normal and a proper height, adult height. When a child is achieved his normal adult height, then we hold the treatment and follow the child that the child is developed the puberty. And second thing is the treatment is basically depend on the type of precocious puberty, either it is the gonadotropin dependent or independent, and then other certain underlying cause. The newer development of this treatment of the precocious puberty have a successful use of the synthetic luteinizing releasing hormone LHRH. They can stop the precocious puberty with the low dose for a prolonged period till the child is achieving his normal height. And at the time of that, when he achieve his height, then we hold this LHRH and we continue the secondary, we continue the child to achieve his secondary sexual characters and then to reach to the Tannery stage 5. These are the steps of the management of the treatment for the precocious puberty. In precocious puberty, so you clear about it. Give first of all, if a child comes to you with the development of the secondary sexual characters, to look at the age of that child and plot it on the Tanner staging. In a male, high length and the scrotal size and the thinning of the scrotum and of the volume of the testes and the axillary and pubic hair. In the female, you can plot Tanner staging with the development two things. Number one is the budding breast, and number two is the development of the pubic hair and the axillary hair as well. In the female, basically, they start secondary sexual character with the name of thelarchy. Thelarchy means the development of budding of the buds. This is thalarchy. Then there is the development of pubarchy. Pubarchy means there is the development of the pubic hair, that is puberty. And ultimately the and a final stage is the development of menarche, and that is the first menstrual cycle, that is called menarche. And finally with the child, baby and a female, it can be developed a total proper maturation. Initially in the maturation, the menstrual cycle is irregular, and the duration is different, but with the passage of the time, after 2 or 3 menstrual, they can be achieved up to the 5 to 7 days of their maturation and a proper 28 days of the cycle. And there is a different menstrual mood changes, and then there is and the stages. So we can check with these things, and investigate according to them, and finally we treat with this, and hold the puberty till the child is achieving height, and then we withdraw the treatment when the child is achieving hits his or her normal height, and proper now check the normal growth, and then we follow the child accordingly. In the delayed puberty means he crossing his age of the different age from 10 years in a female, and in 16 years of the male, and there is no secondary sexual characters, and there is when the orgasm has passed, and usually age is the onset of the puberty with the no physical and hormonal sign that is to be begun. The delayed puberty most occur due to the malnutrition in you all you know we are living in the third world country, and there is the malnutrition is a very common, and this is one of the cause. And there is a certain multiple second some systemic diseases, they can cause the delayed puberty, and sometimes there is the defect in the reproductive system that is called the hypogonadism, that can be unresponsive to the sex hormone. Puberty may be delayed with several years until still the normally, in which case the consider constitutional delay and a variation of the healthy physical development. This constitutional delay is very important, and we can follow these children for the different age group. And in the constitutional delay in the puberty and physical health, there is the certain changes, and if there is the medical history of the family history is important. Delayed puberty basically defined as a clinically absence or incomplete development of the secondary sexual up to at the age in which the 95% of the children of that area, that same age and same sex, is achieving or start to achieve the secondary sexual character. From the National Center for the Health Statistics of USA, they said that 95% in the US, the age of the boys up till the age of 12 years, and in the female, there is no secondary start, nothing, a secondary sexual character in a female till the age of 12. That means that there is, you can label it, that this is a delayed puberty. Delayed puberty is usually occurs with the inadequate gonadal steroidal hormone. Gonadal steroidal hormone means in the male there is testosterone, and in the female there is the estrogen and a progesterone formation, that is the caused by the defective gonadotropin secretion from the anterior pituitary gland, and this hormone is called the gonadotropin releasing hormone, the short form is GnRH, from the hypothalamus, and there is the functional defect of the patient with the constitutional delay in the puberty. It can, however, also be caused by the variety of hypothalamic, pituitary, or sometimes the gonadal disorder. This is basically the axis. There is the formation of the gonadotropin releasing hormone in the hypothalamus. They can stimulate the pituitary gland, and the pituitary gland form the FSH, LH, and testosterone. These FSH, LH in the female stimulate the ovary and the androgen to form the final sex hormone like the testosterone in the female and the male, and the LH, FSH in the female. So this is the proper access of the formation of the different hormone, and they can stimulate in a different age group, to form the secondary sexual character. So the one thing you can differentiate in the secondary delayed puberty, either this is the primary or secondary hypogonadism. In the secondary hypogonadism means that there is the central hypogonadism. So the high serum concentration of FSH and LH are associated with the various causes of the gonadal disease, and that is because of the primary hypogonadism. And this defect is receptor on the membrane of the gonadal cells. The low or normal LH-FSH concentration are associated with the various causes that diminish because of the gonadotropin releasing hormone induced gonadotropin secretion called the secondary hypogonadism. So in case of primary hypogonadism or the primary delay, the LH-FSH is high, but in case of secondary hypogonadism, LH-FSH is low. As this is the cycle of the formation of the different hormone. In the secondary there is no gonadotropin releasing hormone, so there is no stimulation of the pituitary gland and the no formation of LH-FSH. So the LH-FSH is usually low, but sometimes it can be normal. And this disease, the delayed puberty, because of the hypothalamic dysfunction, either the atomic or functional, then maybe this is secondary with the hypopituitarism, hypothyroidism, and hyperprolactinemia. These are the different other causes of the delayed puberty. This is the causes of delayed and abnormal puberty. The central means the secondary delayed puberty, and that is in both sexes in a male and a female is almost same, and there is basically the hypothalamic pituitary axis. The most important thing is the constitutional delay in a growth and a puberty, that is called CDGP, that is constitutional delay in the growth and a puberty, and that is sporadic or sometimes it is familial. Chronic illnesses like some kidney disease or certain other chronic disease of the GIT like Crohn's disease, they can cause the delay in puberty. In malnutrition in this age group, malnutrition not the PCM, because the PCM is the disease up to the age of 5 years, but in this age group, when there is the child is in adolescence age, so the anorexia nervosa is important, and sometimes there may be the cystic fibrosis or the celiac disease. The excessive physical exercise properly in especially in athletes and in gymnastics, there is sometimes there is delayed secondary sexual character and a delayed puberty in these children, in these girls and boys. And the other thing is the psychosocial deprivation, steroid therapy, and the hypothyroidism is one of the cause of delayed sexual uh, secondary sexual character and delayed puberty in both sexes, male and female. And the secondary sexual character, the impaired hypothalamic pituitary axis. These are the different diseases. In different diseases, there may be the tumor, like the congenital anomalies, like there is the septo-optic dysplasia or congenital panhypopituitarism. Sometimes the secondary with the treatment of the any malignancy, the radiation or trauma or surgery or head injury, and the gonadotropin releasing hormone, luteinizing hormone, follicular stimulating hormone deficiency, that is in sometime in two main diseases, that is called the Prader-Willi syndrome and Bardet-Biedl syndrome. These are the two main syndromes in which there is the delayed puberty with the certain other different things. So but the peripheral puberty, the primary puberty, is different in a male and the female. In a male, there is the testicular damage by any cause, like the cryptorchidism. Cryptorchidism means the undescendant testes, testicular torsion, atresia, or the testicular infection by any cause. So these are the different causes of the bilateral testicular damage, and the certain syndrome, mainly in the male, that is the Noonan syndrome and the Prader-Willi as well, and the gonadal dysgenesis, and one and the most important syndrome is Klinefelter syndrome in that disease. And the radiation or the loss of the both testes, and the cyclophosphamide is the drug that can be damage of the testes and a testicular cell. So there is the decreased production or totally absent production of the testosterone hormone. In the girls, if you look at this, there is the one and most important thing, one and the most important thing in the in the gonadal dysgenesis in the female are the Turner syndrome, and the pure gonadal dysgenesis. Definitely, the radiation of the total or abdominal radiation, they can damage the ovary, or the use of cyclophosphamide and the polycystic ovary syndrome, or sometimes there is a toxic damage by the galactosemia, or in thalassaemic patient, the iron overload, they can be cause the damage of the ovary, and this damage can decrease production of the FSLHS, and ultimately the child can be presented with the delayed puberty. The most important thing in a male or a female patient, the delayed puberty, is constitutional delay of the growth and puberty. And in this situation, there is sometimes you may have the family history of constitutional delay, so there is no need to be investigated. But in this situation, you can start with the central cause or the peripheral cause, or you can check the certain chronic underlying diseases of this child, like the blood ferritin level, the blood sugar level, the renal function test, the electrolyte, celiac screening, UNDR for the blood, or the protein. You can check all these things to check with is there any chronic disease in this child or not. For the looking for the disorder of the access disorder, there is the different thing like Klinefelter syndrome and Turner syndrome. You can go for the check the chromosome. In a Turner syndrome, there is there is a XO. So these are the different chromosome, and according to that presentation, you can check chromosome. You can check go for the chromosome or not. Then you can check the basal FSH and LH, and the serum estradiol and the testosterone. Pelvic ultrasound is very important in the girl to check the intra-abdominal female internal organ, especially the ovary, and definitely you look for the bone age. The bone age usually delayed in the children with the constitutional delay. And, the, and there is the deficiency of the growth hormone and the hypothyroidism as well. So it is one in favor of that. If you suspect the constitutional delay, you can check the bone age, you can check the thyroid hormone, the TSH, and the growth hormone. In GnR is gonadotropin releasing hormone. In some cases of the central delay are difficult to assess, and the GnR test cannot be distinguished between the psychological delay and a gonadotropin deficiencies. So it is not a very important test in the second delayed puberty, but you can go for the MRI or CT scan of the pituitary and surrounding structure. Maybe there is some problem in the pituitary gland or around the pituitary gland. In the management, as you know, a CBGP, like the constitutional delay in the growth and the puberty, is the most common cause of the delayed puberty. The medical treatment is not usually necessary, and just the reassurance and the monitoring is sufficient. But in the monitoring, you wait for a couple of months, but still there is no improvement in the constitutional delay. So in boys, there is the induction of puberty, and that induction of puberty is basically to start with a short course of the low dose of the testosterone therapy in the boys to start with the puberty. Once you start the puberty, there is the stimulation of this axis, and there is the production of the GnRH and all the total excess of this hormones. But in the girls, there is the start with the gradual increase of the estrogen treatment and the gradually clinical cyclical progesterone therapy when the adequate estrogen level is achieved. Then when the estrogen level is achieved, you can give the estrogen to this child. So as I previously told you, okay, you should be check the underlying cause of the chronic diseases, and you treat that disease. Like if the child is thalassaemic, there is definitely iron overload. So you check the ferritin level, and if the ferritin level is high, you start desmopressin this to neutralize the this for for the utilizing of the extra ferritin level and mobilize that extra ferritin level and remove it. Yeah, right. Okay, we can answer at the end, inshallah ta'ala. Yeah, yeah. I'll wait for a couple of minutes, and there is certain things. Okay, fine. In the primary testicular and ovarian failure in the boys, the regular testosterone injection, if there is a primary failure, the regular injection and right now there is the certain oral testosterone is available. There is a patches, gel, and a buccal pellet as an alternative for a longer period. But if there is not sufficient evidence that the routine use of the other therapies like the growth hormone and the other drugs for the constitutional delay. But is the total primary failure of the testis, there is a lifelong use of the testosterone. Simultaneously, if there is an ovarian failure, then there is the estrogen replacement should be gradual to avoid the premature fusion of the epiphysis. The one thing I again told you, the main thing, the management is to achieve the normal adult height of that specific YMA curve, and then you can start these treatment. As you know, when once you start this treatment, there is the closure of the epiphysis, and the ultimate height is short. So all these things gradually increase the dose of estradiol and the cyclical progesterone therapy. Once the adequate estrogen level have been achieved. The low dose of the oral combined oral contraceptive pill can be used because in that pills there is the initially a level of the estrogen, and then there is a cyclic progesterone on that drug. So you can use in the female as well. In the central delay, if there is like a craniopharyngioma, the one of the typical presentation of the central nervous system disease and the pubertal induction and hormone replacement. In the counseling with the respective sexual function and fertility, if there is the certain abnormal thing, then you can be appropriately counseling in the central delay. So thank you very much. It's around 6 or 7 past 1. If there is any question, and one question is asked by for how long we can use it. Okay, fine. The doses and it's basically, as I told you, when once we achieve the secondary sexual character, and there is a start, and especially in case of the constitutional delay, and there is the normal production of their internal hormone, so we stop this drug. What is the treatment plan for precocious puberty, which is non-GnRH dependent? Okay, fine. Okay, this is basically if it is non-GnRH dependent, so that is basically it is from the testosterone or the ovary. The treatment is same. Basically, we hold the secondary sexual character. If we hold the secondary sexual character, then the treatment is same. Okay. Acha, what do you mean by the constitutional delay? Okay, fine. The constitutional delay means delay. There is in a family history as well. For the certain time period, there is no secondary sexual delay, sexual characteristic, but there is a history of achievement of that secondary sexual character in the family as well. So constitutional delay is basically that means okay, initially there is no, according to the Tannery staging, they are not achieving with their Tannery stage, but after that they can achieve in the family. This is called constitutional delay. how does LHRG stop sexual maturation in the precocious puberty? Yes, that is the synthetic. Synthetic LHRH is basically is stop the production of estradiol and estrogen and progesterone in the female and the testosterone in the male. So there is stop the maturation in the precocious puberty. That is synthetic LHRH.
जी सर.
देखिए बच्चे और क्वेश्चन पूछना चाह रहे हो एक ने थैंक इंदिरा ने थैंक यू बोला है
सर और तो कोई क्वेश्चन नहीं आया अभी तक.
any other question from the student or otherwise we stop